We are trying to develop tomorrow's solutions today here at Nationwide Children's Hospital.
Our approach is to lead the transformation of child health so that the children receive the best care possible.
It's been a wonderful 25-year journey because the alignment of the mission and vision of Nationwide Children's Hospital so well aligns with our aspiration in the Heart Center.
In the last 134 years, the Children's Hospital has grown to over 700 beds, to one of the 3 largest children's hospitals in the United States, and to one of the top 10 NIH-funded research institutions in the United States.
Nationwide Children's is a very special place. Different probably from other organizations, Nationwide has done a great job at identifying what are the values that should guide us as a community of healthcare providers and caretakers. That work has evolved into the definition of our values and the one-team culture. The one-team culture is not just a saying or just words that most corporate groups will have. For us, it's really important as that we focus on delivering best outcomes for kids.
Here at the Nationwide Children's Hospital Heart Center, we pride ourselves on clinical excellence and innovation, and we design ourselves to be a hub for that innovation so that we can best serve our most complex patients. When patients come to our Heart Center, they know that they have access to any subspecialty that they need to be able to tackle the most complex of problems.
And that's done through amassing a specialized team that are very focused on congenital heart surgery and congenital heart problems. And through that expertise, then can have the insight to investigate and come up with new solutions and innovate. And we've been very successful in innovating different ways to manage complex congenital heart disease.
The Center for Regenerative Medicine focuses on translational cardiovascular research. Specifically, we perform research using tissue engineering. And tissue engineering can be defined as an interdisciplinary science that attempts to leverage the fact that cells have an innate capacity to multiply and then self-organize into functional units. And using this technology, we've developed both tissue-engineered heart valves and tissue-engineered blood vessels that can be implanted in patients.
We are aiming for less invasive approaches for neonates with congenital heart disease. That started with the establishment of the first hybrid room in the world for children with congenital heart disease. That has certainly transformed the lives of these neonates because the hybrid room enables the catheter-based approach to be performed at the same time with surgery in the same location.
What we've learned through an operating room and a hybrid catheterization lab through animal experiments is that we can actually impact the long-term consequences of single ventricle heart disease in children if we make some adjustments. So for instance, the development of the tissue engineered vascular graft and the ability of us to have a graft that grows with you is a key element for the potential solution for patients who have a Fontan operation and may at some point develop Fontan stenosis.
My lab has actually discovered novel genes that cause congenital heart disease, and in total now we have been able to identify numerous genes that are important for congenital heart disease. And what we are doing now is actually translating that to the bedside. So we're actually taking all this genetic information that's been accumulated, and we're working with our Institute of Genomic Medicine, and we completed a research protocol where we actually are doing genome sequencing on patients who undergo cardiac surgery, with the idea that if we understand that they have genetic syndromes, that we can provide better care for them.
What we've come to understand here at Nationwide Children's, particularly in a couple areas. One is expedited or intraoperative extubations, as well as reduced need for blood products and other aspects to minimize the impact of surgery on kids, is that it's oftentimes what happens in the operating room and in the perioperative period that sets children up to be able to go home as soon as possible after surgery.
One of the great advantages we have in a large medical center like this is that we have trainees and budding experts around us all the time. These are people who are dedicating their lives towards the medical field and specifically towards congenital heart disease. And so it's our duty really to mentor and teach those providers and those trainees to become experts in those fields and to advance our field for years to come.
The future of our surgical discipline relies heavily on one-to-one delivery of surgical expertise and skills to the next generation, because the next generation will take over the excellent care for our patients.
It has been impressive the impact we can have, the steadfast, relentless pursuit of improvement for the care of children, whether they be here locally in Columbus or things that are developed here that are available for children around the world.
Thanks for watching, but now an important disclaimer. The content of this video is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Viewers should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.